I'm here with Ali,
Yeah.
and he's here with 4Web, and they have something incredible to share. Tell me, what is it about your products that makes it better for the patient?
Right, thank you. This is Ali Kiapour, leading the research and development activities at 4Web Medical. So the technology that we have been working on as 4Web Medical was development of a device, what we call an antibiotic fixation technology, for basically 3D printed device, which can be used to improve the outcomes of the existing gold standard for surgical procedures.
How's this going to benefit the patient?
This technology can in many ways affect the standard technique for treatment of back pain and any disorders related to the spine. So the way it works is that so we have basically a 3D printed technology, which we have clearly shown through our research and collaboration with big universities, that the 3D printed surface, which is basically a byproduct of a manufacturing process, can help these cells to differentiate at a faster rate and improves basically the process which we call fusion. Fusion is a process which basically happens after the surgery, and it's very critical for the success of the clinical success of the procedures, because you want to show that the patients recover as fast as possible and the bone grows through the entire device and connecting the two adjacent vertebrae. And basically that's what this novelty of this product is, because with the surface roughness at the surface of this technology, and also the mechanism, the way it's designed, so it takes the anatomical loads which come to the inner body device and converts those to the microstrains. Those microstrains, according to a ton of studies and literature, are very important, because microstrains can help these cells to differentiate faster, so it can amplify the cell differentiation and gene release process.
So a patient's going to get this. If
Yes.
the doctor chooses this,
Yep.
they're going to come in for their post-op, and their bone growth is going to be significantly higher than a competitive product.
That's what we are trying to demonstrate through the clinical studies that we are doing, and also research, and also some mechanobiology research that we are doing with the universities. But the idea is, yes, I mean, according to science, which is already there, so this device is able to take the mechanical loads which come to the spine and break it into the micro-level strains, which are critical for bone cell differentiation and have a faster recovery and fusion.
Excellent. And so that benefits the doctor, that benefits the system. We're going to have better outcomes.
Yep.
So
Yep.
everyone's happy then at the
Absolutely.
end of the day. And so you've been around a while. Like 4Web is not brand new or anything.
Yeah.
It's I'm trying to think of the first time I remember seeing you around. But you're over a decade now? How
Yeah, well, yes. 4Web was basically started like more than a decade ago, and it's been actually one of the first companies and the pioneers in the area of 3D printed implants for a spine application and orthopedic application. So the first products were, I think, launched a long time ago, so I think had some great success with our customers and had a lot of great clinical data, and some other products were developed alongside later on. But I think we have been selling these devices for a long time.
For a long time. And what's to stop you from just taking your coating and applying everything with it? And just, if bone needs to grow on it, put your material on it.
Yeah, this is this is a 3D printed process. It's not a coating. Unlike there are some other technologies out there which take like an existing material and apply a coating on it just to get a rough surface. But this surface that we have on this product, it's a byproduct of the manufacturing process.
It's more about the shape.
It's the shape.
Than it is about.
Exactly.
Yeah. Okay. So it's part of its origin.
Yes.
Right. Okay.
Yes.
I understand. Wow. Does everyone else understand? Answer the question.
Without trying to get into a very scientific details of it, but honestly, this is in an area everybody has.
How many cases have been done since you guys got your FDA approval?
Well, that's a great question.
Thousands, millions?
Yeah, not millions, but definitely thousands.
Thousands? Yeah, that's good. Hey, congratulations.
Thank you.
Thanks for being on the show.
Thank you.